Alzheimer's is optional. People should not be getting this. It should be a rare disease. If we would all get on active prevention at the age of 40, or if you're over 40, please get on active prevention, or if you've got symptoms, on earliest treatment. And here's why. If you actually look at the changes, for example, on a PET scan, you can begin to see PET scan changes even in some people in their late 20s and 30s.
Wow.
So when I was training in neurology, we thought of Alzheimer's as a disease of our 60s, 70s, 80s, 90s, but it's really starting 20 years before a diagnosis. So it's really a disease of your mid to late 30s, 40s, and 50s that just gets diagnosed 20 years later.
Here's where I want to start this conversation. And by the way, welcome to my podcast. We've
So
had
great
some
to be
great
here.
guests. Yeah, your knowledge, your passion for helping women prevent Alzheimer's is so needed. So I'm really excited to bring you to my audience. So thank you for joining me today.
Thank you so much for having me. And, there is so much we can do. I'd love to talk at some point about, we have a patient recently, a woman who's in her early 70s, who's just had these dramatic improvements, which we can see on MRI and on her testing. And every time people get better, we've had, thousands now. It's just so great to see it, that it never gets old.
I bet.
Yeah.
Well, let's start this part of the conversation, because I think a lot of the women in their 40s and 50s were starting to think about Alzheimer's and dementia
Yes.
now.
Yes.
What are the early warning signs? Because I think we dismiss memory loss and inability to hold on to information as an aging thing. But
Yes.
are there things we can go, wait a second, this is a big red flag, you're going to want to do something about this?
Yeah, I think it's important to kind of string together a couple of important facts. So the first thing is, as I said earlier, this is now, Alzheimer's is optional. People should not be getting this. It should be a rare disease. If we would all get on active prevention at the age of 40, or if you're over 40, please get on active prevention, or if you've got symptoms, on earliest treatment. And here's why. If you actually look at the changes, for example, on a PET scan, you can begin to see PET scan changes even in some people in their late 20s and 30s.
Oh, wow.
So when I was training in neurology, we thought of Alzheimer's as a disease of our 60s, 70s, 80s, 90s, but it's really starting 20 years before a diagnosis. So it's really a disease of your mid to late 30s, 40s, and 50s that just gets diagnosed 20 years later. That's the first thing to
Wow.
understand. The second thing to understand is you go through 4 stages, and especially in the first 2 stages, it's really easy if you know what to do. So the first stage you go through is a pre-symptomatic stage. You don't know you have problems, and this is typically occurring, as I said, in the 30s, 40s, where you don't know that you have problems, but if you were to do spinal fluid, or if you were to do a PET scan, you'd already begin to see changes in many people. And just for numbers, this dwarfs the pandemic. We've had over 1 million people who have died from the COVID-19 pandemic. About 45 million of the currently living Americans will die of Alzheimer's if we all don't get on active prevention or early treatment.
Wow.
So that's the important thing to know. The second stage is subjective cognitive impairment. You know there's something wrong, but you're still able to test in the normal range. And this is just what you were talking about, where your doctor's saying to you, well, this is just normal aging. I hear this all the time, and it just
Yeah.
kills me to hear it. Because when someone knows that something's changed, we should listen to them. What they're telling you is that something has happened. And I had a great example a few months ago where a physician himself was saying something's wrong. His wife, who's also a physician, said, yes, something's wrong. They took him to a neurologist. I mean, this guy actually had already gone into stage 4, which is actual dementia. And the doctor said, this is just, you're getting a little older. This is normal for your age. Oh my gosh. That was just completely wrong. And actually, this guy turned out to have normal pressure hydrocephalus. You just cannot miss these things. So it's important to listen to people when they tell you something's not right with their memory, with phone numbers, with getting lost, with just not feeling comfortable, with not being as responsive, with not being as quick. These are all the common things. And the way to break this down is you think about 2/3 of people that are having cognitive decline, it starts with an amnestic problem. So in other words, you're having memory problems. And the most common one is, yes, you may remember the name of your first grade teacher. So long-term memories stay for a long time, but the new ones are having trouble. So they'll say, yeah, I don't remember what I had for breakfast, or I don't remember. Patient zero, the very first person that we started with who did beautifully, and by the way, is still doing well and is now a brain health coach, came to see me in April of 2012. And she had gotten on a plane and she got to the other end and she didn't remember what she had gotten into the plane for. She actually got on the plane and went home. She didn't know what she was there to do. So now some people will say, some neurologists will say, for example, if you don't remember where your car was parked, you're okay. But if you don't remember that you came in a car, you're in trouble. But that's a later stage when you don't remember that you came in a car. If you normally remember where you parked your car and now you're not remembering where you parked your car, that is a concern. Things that have changed. If you were typically good for your life at remembering phone numbers and now you're not remembering phone numbers, that is a problem. And so again, you have the interesting thing, this SCI, subjective cognitive impairment, lasts about 10 years. So we have a wonderful area, a window of opportunity to help so many people. And yet, those people, the people who are in that SCI phase, virtually 100% of them we can make better. You look at what's causing it, you look at the appropriate blood test, which is why I recommend everyone please get a cognoscopy. Check these things, because what happens is what ultimately becomes Alzheimer's and starts often as brain fog or starts as things aren't quite right, something's not quite right. Really, in the lab, we can boil it down to two major players. This is a network insufficiency of your brain. You're not able to support that 500 trillion synapse network that you were supporting for the last 40, 50, 60, 70, 80 years. And it boils down to two big things. One is the innate immune system. So it's ongoing inflammation, which are a drag. It's a little bit like, you can't run as well anymore because you're wearing lead slippers. You're slowed down. So the inflammation is huge, and it can be from leaky gut, poor oral microbiome, herpes simplex on your lip. It can be from a poor diet. It can just on and on and on. It can be from tick-borne illnesses, exposure to mycotoxins. So all these different things that are creating this ongoing drag by activating your innate system. So you've got to figure out what those are. You got to address them, and that's what we do. Then the second piece, which is equally important, is energetics. So you use a lot of energy to keep that synaptic network going. You know how you feel when you haven't slept in a few days.
Oh, yeah.
And I remember from when I was an intern, you go a few nights without sleep and the energy is gone.
You're toast.
You need that energy, and that is cerebral blood flow. And that, of course, vascular disease, one of the risk factors for Alzheimer's. Second thing, it is oxygenation, SpO2, your saturation of oxygenation, which is why people who have sleep apnea are at such an increased risk. It is a huge issue. So just another case I just dealt with over the weekend. The woman had done well. She was actually one of the ones who wrote her wonderful story in the book, The First Survivors of Alzheimer's. This was Sally. She did a great job. She's now in her 7th year doing really, really well. She's ApoE4 positive. She has the genetic predisposition, doing very well. And then she started noticing over the last 6 months or so, kind of taking a backward step. Something is not right. So, okay, we got to go back and look what's been missed. Do you have new exposures? And one of the things was she did have some new water intrusion into the house. So, okay, we're dealing with that. Do you have an activation of your innate immune system? So I said, you really haven't checked to see sleep apnea. Well, I'm not snoring. I'm not set up for sleep apnea. It's more common in men. That's fair. Okay, it's more common in short, thick-necked men. Okay, that's fair. And men who snore. Okay. But when she did then, I encouraged her, please get it checked out. She had severe sleep apnea, undiagnosed.
Okay, my baby's coming to you. Eat like a girl. You want to know the foods that will support hormones? Guess what? I have them for you already. It's a free giveaway. Just click the link below and I'll send you a list of all the foods that support amazing hormonal health.
So she wasn't getting oxygen when she sleeps.
Exactly. So her oxygenation is going down. And not only is the oxygenation going down, of course, your adrenaline is pushing to get you, oh my God, wake up, something's wrong here. And so, okay, now we'll see how she does. She's ending up now starting on some CPAP. We'll see how she does. But the key is you've got to look at the energetics for your brain. And that, as I said, blood flow, it's oxygenation, it's mitochondrial function. If your mitochondria are not doing well, you're not doing well. And some beautiful work. Please check out the paper, and I believe it's freely available online. Beautiful work from Professor Rick Johnson, who published this just a couple months ago. He's from University of Colorado, and I'm actually a co-author on this, and so is David Perlmutter and several others. And what Rick found over the years is that fructose has a very interesting impact on your system. Now, this doesn't mean you shouldn't eat an apple. This means you shouldn't have a ton of high fructose corn syrup. And this goes back to our evolution. And what he discovered was, okay, if you're a primate and you're getting ready for a winter, you need to store fat and you need to turn down the energy. So even though fructose is a sugar, what he found is it's actually turning down your ATP by something like 15% or so.
Oh, wow.
So here you've got a system that's already right on the edge, and now you're pushing it down further. And what he pointed out, which I thought was brilliant, was that you just go right down the list, the things that we accept as proof of Alzheimer's, the PET scan changes, and the changes in biochemistry, and the changes in specific areas of the brain. These are the same ones that fructose hits. So there is a beautiful correlation there. And I do think it's one of the reasons that so much high fructose corn syrup has hurt us over the years. And as he points out, you can get to the same place by pushing up your glucose chronically as well. And of course, it's always been known. Insulin resistance has been a big problem. It dramatically increases your risk for Alzheimer's disease. Metabolic syndrome, which includes insulin resistance, is one of the common contributors to Alzheimer's. So that's the third piece. And then the fourth one is your ketone level, because you've got to have something for your mitochondria to burn, and that's either going to be glucose or ketones. In a perfect world, you are metabolically flexible, as you know. You can go back and forth. But of course, what happens for the people who are beginning to have brain fog and things like that, they've lost both. Because because of the insulin resistance, we can't burn glucose the way we were once able to. But because of the high insulin as part of insulin resistance, that prevents you from making ketones. So when I see people who are now having brain fog and going on to cognitive decline, that's an energetic emergency. We need to get back their insulin sensitivity, and we need to get back their ability to make and use ketones. So we usually just start with some exogenous ketones just to get rid of that emergency until they can naturally get into this metabolic flexibility. So again, you come back to this and realize nobody should be getting dementia, but 15% of our population is dying of it. It's huge.
So would you say that if there was one first step in to preventing Alzheimer's, it's metabolic flexibility? Like, let's just start with this system to be able to bring glucose down after you eat and switch over into a fat burning state to make ketones. Is that at the core a foundational place that everybody could start?
Everybody, that's the best way to start. But you have to remember, because this is a complex network, there will be people who will respond beautifully to that, and others where that's not the rate limiting step. It'll be their sleep apnea, or it'll be their leaky gut, or it'll be their sudden loss of estradiol. And so, as you know, for women, this was a beautiful study out of the Mayo Clinic a number of years ago, for women who had undergone an oophorectomy, so who may have had trauma or things like that, at the age of 40 or younger and didn't have HRT, And of course, we recommend BHRT, but for people who didn't have HRT, they ended up doubling their risk for Alzheimer's. Even though the Alzheimer's was years later, they were already beginning those biochemical changes that led to Alzheimer's. So this is, again, why I encourage everyone, get things optimized. You never have to get to that point where you are now downsizing the network.
Yeah, and the interesting thing on estrogen that I've noticed is as estrogen declines, you become more insulin resistant. Yeah. And so women start to notice it in their weight. But what I'm hearing you say is, hey, we got to pay attention to what is happening in the brain.
Absolutely.
So, and can you talk a little bit, you know, I can tell you as a 53-year-old woman that I've had moments where I'm like, can't remember where I parked my car, can't remember why I walked into a room. And then I come back to my foundational lifestyle tools and say, am I doing this? Am I doing this? And I clean that up.
Yes.
So what's the difference between just age appropriate moments like that and, hey, you're heading towards Alzheimer's? How can we tell the difference, or do we need to have some kind of a bigger test to know?
Yeah, so the bottom line is yes, but here's the thing. Don't ignore that. People keep, the neurologists keep telling us, oh, and my colleagues, and it kills me. They say, well, it's probably not Alzheimer's, so don't worry about it. Well, then you come back the next year and they say, oh, now it is Alzheimer's and there's nothing we can do. So don't be passive. Even if it's just a little brain fog, you can fix that. And you want to be functioning better. So it goes back to, the old Alec Baldwin, always be closing. This is always be optimizing. So keep on optimizing. Make sure you're metabolically flexible. We think in terms of the 7 basics and then the specifics for if you've got a certain infection. So the 7 basics are diet, exercise, sleep, stress, brain training, detox, and some targeted supplements. Get those,
Amazing.
Get your ducks in a row there, and you would be amazed at how many people, they're looking for that crystal on the forehead, that new thing that is, just out there and that's never proven. And then what they miss is the basics, just what you're talking about. You go back to the basics. Yes, you do need some estradiol. Yes, you do need some progesterone. Yes, you do need pregnenolone. You do need appropriate thyroid. You do need appropriate insulin sensitivity. You do need to make sure that your gut is healed. The gut is involved in so many of these neurodegenerative diseases, from Parkinson's to Alzheimer's, to on and on, ALS, and you name it. And we don't give that enough attention.
Yeah. I think one of the challenges is that when you hear all the things you have to do, for women, we come screaming into our 40s. We have no idea about our hormones. We have no idea what's ahead of us. And then all of a sudden we start feeling different than we have years ago. And then we look at those 7 things and we're like, oh my gosh, I've been living the wrong lifestyle. And my big message is the lifestyle you lived at 35 does not serve you at 45. You've got to change and do something different when you go into those perimenopausal years.
But the great news is just start with one. As you said, just optimize your diet. So we call it Keto Flex 12-3. It's a plant-rich, mildly ketogenic diet with appropriate periods of fasting, typically 12 to 16 hours overnight. You will have more energy. You will have better brain function. You will feel better. You will sleep better. Start there. And then you can just, add something new every few months. And it also gives you that feeling, it gives you positive feedback. And once you get that positive feedback, like, wow, okay, this really helped. It really supports you. And, I want to go back to it because I didn't finish answering your question. Apologies for that. You said, what are the early signs? As I mentioned, 2/3 of people, it's memory. But the other 1/3, it's what we call a non-amnestic presentation. It's the non-memory things, and it's planning. These are the people that lose their jobs the quickest. They can't plan the way they did. They can't carry out their jobs, and they get fired. And this can be in your 40s. We see this all the time. Or loss of calculations. They can't figure a tip. Or loss of recognizing faces. Or getting lost with driving. These are the sorts of non-amnestic things. Word finding, that's another common. It was like, wait a minute, what happened to my vocabulary? I just can't come up with these things. And sure, you can always say, well, it's probably not Alzheimer's, but 20 years down the road, it may be. So
Yeah.
get it while it's early, and you never get to the point that you have to worry about Alzheimer's. My argument has been, I mean, I'm now just turning 71, so I'm an old guy, but my generation is the last to fear Alzheimer's. Your generation, our daughters are now in their early 30s. Their generation and your generation are the first not to have to fear this disease. It is
Amazing.
now optional. Get
Yeah.
evaluated, get on active prevention, and we can make dementia rare. That doesn't mean that nobody in the world will ever get it, but it means it will be much more rare. It is now the number one cause of death in women in the UK. It's
crazy.
incredibly
In the
common.
UK. Wow. Crazy.
And we can
crazy.
do a lot about that. Yeah.
Yeah. I will tell you, as I went through my 40s trying to balance my own menopausal symptoms, the two things that moved the needle on my brain the most were detoxing, so
Yep.
get heavy metal detoxing, and metabolic switching, so I'm getting my more ketones to my brain. And the big thing that I noticed was I stopped losing my train of thought when I was talking to people.
Yep.
There was no longer ums. I no longer like just stopped mid-sentence. It seemed like I had a more continual directed thought pattern. So just from those two, of the 7, are there ones that move the needle quicker, or are they all equally as important?
So it's interesting. It depends on if you're more of an inflammatory person or an energetic person. And so we just had a great example of someone with posterior cortical atrophy, PCA, and this is a patient of a health coach, Carrie Mills Rutland in New York, who's doing a fabulous job. Really impressed with Carrie and all the things she's doing. And this person actually was improving, and it turned out to have some detox and it turned out to have some infection as well. But when she started EWAT, exercise with oxygen therapy, she went kind of from this to this. So it depends a little bit on where. Now, I see the big improvements are people when they get into ketosis, and that starts with exogenous, but then switching over to endogenous. And when they become, as you said, metabolically flexible. So they're now using the energy appropriately. And the other one I see is with EWAT. I see big improvements in people time and time again because the oxygenation is now getting to the furthest reaches. There was a beautiful study out of Israel about 2 years ago where they were showing that they were using HBOT, the hyperbaric oxygen, but
Yeah, I
that
have
doesn't
one.
give you the problem with that. It's great, I like it, but it doesn't give you the exercise part of it.
Right.
Whereas the EWAT gives you both. In any case, yes, those things that help to get the oxygenation to the furthest reaches. And as we get a little older, that's an issue. So, things like for the inflammatory side, things like resolvins, SPM active, from Professor Charles Sirhan of Harvard, who discovered resolvins and worked with Metagenics to develop these. And I don't work for any of those people. I have nothing to do with it. Nobody pays me to say it's good. We're just always interested in the best outcomes. And so far, this approach with these resolvins has been very helpful for people with inflammation. Of course, then you have to find out what's causing the inflammation. Is it a leaky gut? Is it a poor oral microbiome? And you have to address those things. We have people where the unknown abscesses, where cone beams will find the abscesses. So the bottom line is dig until you find it. But there are some basic things you can do, as you said, starting with becoming metabolically flexible.
Yeah. And if you decide to go down the path of HRT or BHRT, are you immune from having to make those 7 lifestyle changes? Like, does it lessen the intensity that you need to focus on your lifestyle?
It improves things. So each of these, so what happens is, imagine that you have a network. It's a little bit like thinking about a country. So what happened in early 2020? We all heard there was a new insult to our country. It turned out to be COVID-19. And so we were told, shelter in place, socially distance, don't go into work, pull things back. And of course, the country went into a recession. That's exactly what your brain is doing. It is experiencing these different insults, and drop in hormones is one of them, but it's also experiencing things from your oral microbiome. The neuropathologists have found in the brains of patients with Alzheimer's disease oral organisms, things like P. gingivalis, that's a big one, Candida, fungi, molds, yeast, things like this, all sorts of bacteria. And interestingly, the amyloid that we associate with Alzheimer's disease is actually an antimicrobial. And this was first described by Professor Robert Moyer and Professor Rudy Tanzi from Harvard several years ago. And I think it was a wonderful find. This is showing us this amyloid is not there to give you Alzheimer's. It's there fighting these insults. And of course, other insults, losing the oxygenation because of things like sleep apnea or upper airway resistance syndrome and things like that. So all of these things are critical.
So with the mouth, does it become, this is an interesting one because every time I've worked with a patient to detox them and we get to the mouth, it's very complicated, especially if you've had multiple root canals, you've got silver fillings. I mean, you're talking a very expensive route to unwinding that. Are there some preventative dental hygiene tricks that we can do to keep our oral microbiome in a good place so it doesn't lead to what you're talking about?
Absolutely. And of course, there are more and more dentists who have become oral systemic specialists and who are interested in the fact that, the oral microbiome is associated with atherosclerosis, is associated with cognitive decline, is associated with cancers. And they're actually finding these organisms in these various places. So there is, unfortunately, communication with the rest of the body. So number one, I recommend everyone get an oral DNA test. There are a couple of groups that do it now. My Periopath is one of them, but there are others as well. Check your oral DNA and see, do you have really high on some of the things like P. gingivalis and T. denticola and P. intermedia and Fusobacterium nucleatum and things like that. So that's the first thing. And then secondly, find out if you have high mercury levels, as you indicated. And as you said, if you've got root canals, these can get infected. So see an oral systemic specialist and see, and it may be that it's pretty minimal. One thing you can do is to take some oral probiotics. These are now available, and they can be very helpful. And then things like dental sidin, biocidin, which we recommend for people that we're treating with cognitive decline. We published a clinical trial. It's freely available online. It's in Journal of Alzheimer's Disease from last year. And you can see that in our clinical trial, 84% of the people actually got better. And these were people in stage 3 and 4, MCI and dementia stages, not just the first two. Those are easy. And we're now actually starting a new trial, a randomized controlled trial at 6 different sites, Hollywood, Florida, and Cleveland, Nashville, Sacramento, Oakland, and San Francisco. So we're really enthusiastic about that. And there's, again, oral microbiome improvement is fundamental to this. And there's a lot you can do without being too expensive or too complicated. But you're right. If you have infected root canals, that's a different story. If you've got a lot of mercury in your mouth, that's a concern as well. The good news is what is causing our brain fog and what is causing our cognitive decline these things are identifiable, addressable, and remediable. And of course, COVID-19 and long COVID and COVID-related brain fog, this is a huge issue and is going to be a problem for years to come.
Yeah, talk a little bit about that because we have ACE2 receptor sites in our brain, right? Yes. So if you had COVID, which they say all of us did, at some point, that created a lot of brain fog. I saw that in my community in such a big way. So I want to make sure we highlight that because a lot of people are experiencing that.
Absolutely. So what's already been published is, number one, people who had COVID are at increased risk for Alzheimer's, unfortunately. And it fits perfectly with the model that you and I just talked about. Yeah. You are changing their inflammatory profile. And there's lots of interesting research going on now. Is it because you've got fragments of the virus in your gut? That's one idea. Is it because there are autoimmune activation? Is it because you've got spike proteins still present? Is it because of other things? And the answer is probably some of all of the above. There are some autoantibodies that people get. Interestingly, people have been taking things like high-dose nattokinase for this. And I think there are improving protocols for long COVID. And so we recommend for anyone who's had COVID, and I had it myself, I think despite vaccination, and I think, as you said, most people have had it. then please, again, get evaluated, get on active prevention, or if you've already got problems with cognition, get on active treatment. Of course, the treatment is more extensive than the prevention, no surprise. But if everybody would get on prevention, just a few people would then fall through the cracks and then go to the next step. Okay, now you have a more extensive evaluation, more extensive treatment. Great. And let's make it so that nobody ever gets to that late stage where you actually get dementia.
And so the prevention is, just so we're clear, is the 7 things you highlighted before. The
prevention is the basics, looking at those things and addressing and find out, do I have, what's my HSCRP? Do I have active inflammation? How does my oral microbiome look? Do I have a leaky gut? And as you mentioned toxins, I was never taught as a neurologist that toxins are a common cause of Alzheimer's, but they are one of the most common causes. And it's whether you're talking about the inorganics, things like air pollution and mercury, the organics, things like toluene and benzene and formaldehyde and glyphosate, or unfortunately, probably the worst is the biotoxins, the trichothecenes, ochratoxin A, gliotoxin. These are real concerns. And unfortunately, if you want to trigger someone's innate immune system, well, you're going to use the beta glucans from molds. I mean, that's like a great way to trigger it. So that's a concern.
I mean, and the toxic conversation is so vast. It's another one that's like overwhelming. Do you have any tips when we're looking at our toxic environment? Like, let's just take a woman's home. Are there some basic tips she should do to minimize the toxins that would affect Alzheimer's?
Absolutely. And so first of all, you want to get an ERMI score. This is easy to do. You can do it online. Or a Hurts Me Too score, any of these scores that will give you a score of how bad is your home with respect to the major molds. Now, there are lots of molds that are not such a problem, but the big 5, Stachybotrys, Aspergillus, Penicillium, Chaetomium, and Wallemia, those are the big 5 that unfortunately produce toxins that are activating your innate immune system, damaging your brain, damaging your immune system as well, often damaging your kidneys, increasing your cancer risk. This has been a problem, again, something where we're all used to having processed food, not realizing, yes, it is killing you. We're all used to sitting there in molds and not realizing, yes, this really is killing you. So, get outside more. It's easy. And another thing that's going to help us all is wearables. Where you can now see, what is my heart rate variability? Am I under constant stress? There you go. How was my sleep last night? Did I get into stage 3, 4, deep, slow wave sleep? All of these things, so helpful.
And so move into sleep. That was what I wanted to talk about next, because again, I look at all of this through a 53-year-old woman's lens. And when I look at that, I say, okay, I know sleep is important, but I've hit a point where if I put my head on the pillow, sleep is not as easy as just closing your eyes and going to sleep. So menopausal women really struggle even when we're on BHRT and doing all the things. So how can we get the best night's sleep possible, and what should we be looking for in deep and REM sleep and total sleep?
And as you know, and I'm sure you've probably had Professor Matthew Walker on. Matt's a great guy who did a wonderful book, Why We Sleep, and talks about these various things. And so, you want to get about an hour and a half of REM sleep a night and about an hour of deep, slow wave sleep per night, and a total of somewhere 7 to 8 hours of quality sleep per night. Most of us don't. As you indicated, it is a struggle. And so there's a whole, sleep hygiene. Is it dark? Is it quiet? I'd say that, and I'm definitely bad in this area. So the area of sleep hygiene, getting up to sleep. So I'm working on the emails and, watching the latest or listening to the latest podcast or whatever. And then it's like, okay, now time for sleep. It doesn't happen that way. Slow down. Get your blue blockers on. Don't be looking at excitatory light. And by the way, blue light, very bad for macular degeneration. we're now taking the protocol we developed for cognitive decline and adapting that with appropriate modifications for early macular degeneration. These things are bad.
Yeah.
Blue light, bad at night.
Horrible.
Get your red light and start to wind down. Do some deep breathing. Get your heart rate variability up so that when you kind of fall into sleep and ease into sleep, that's great. And there are all sorts of good things. You might like to take a little bit of melatonin, as you indicated, appropriate BHRT. Progesterone, low progesterone is associated with poor sleep. And guess what else? It's associated with poor detox. So you need that. You need that progesterone for good detox. You need it for good sleep. You need it for calming down your sympathetic nervous system, as you know. So you're absolutely right. Sleep is key.
Yeah, I now guard sleep like she's my best friend. I've stopped doing red eye flights anywhere. Like I just have prioritized sleep because once you get a good rhythm with it, you never want to break that.
Right.
And I see such an improvement in my brain the next day. But I also know that there's so many menopausal women that are really struggling to have a good night's sleep. Yeah. And there's an art to it, like you said.
Yeah.
So
I was going to say, you mentioned you're a 53-year-old woman, and I think it's very important to point out, when I was training back in the 80s as a neurologist, that we never saw people in their 50s with dementia. This was an older person's disease.
Yeah.
Now it's one of the most common things we see. And there are publications from epidemiologists over the last few years that have shown the increase in dementia in young people, and that's 40s and 50s, has just dramatically increased. It's not yet clear why. Some of this may have to do with changes in diet. Some of it may have to do with leaky gut. Some of it may have to do with toxin exposure. Some of it may have to do with menopausal changes. We don't know. But the bottom line is 40s and 50s is a very tough area now as far as cognition. And so a common one I see, when I pick up a chart and look through all the different things, and it's a 52-year-old woman who is having especially a non-amnestic presentation, problems with planning, things like that. This is very, very common. And so again, another reason to get on that active prevention earlier. So this is a huge issue.
Yeah, I call it an evolutionary mismatch. I feel like we're at a moment where our female bodies are not copacetic with the modern world. And the more the modern world gets more physical, emotional, chemical stress, the more we're seeing women suffering with their hormonal health, their brain health. Like this is the age group that's getting it the worst because the modern world has so many interferences into our own natural healing state. That's the way I look at it.
Yeah.
Do you feel like there's an exercise? So the other thing that I learned as I've gone through my own menopausal experiences, I can't run like I used to. I take shorter runs. I gravitate more to walks and hikes. I'm looking at building muscle more. I do more yoga. Like I was a competitive athlete in my 20s, and I really have dramatically shifted the way I work out in my 50s because of the change in my hormones. Do you think we, as women, we need to all do that? And are there certain exercises that are best for brain health?
It's a great point. And if I were to say a few things that are the best for brain health, one is EWOT. So exercise with oxygen therapy, because you're getting perfusion, you're getting a threefer because you're getting vascular effects, you're getting oxygenation effects, and then you're also getting some muscular effects as well. So it really does help in multiple ways. But as you pointed out, muscle training is equally important in a different way because it is giving you that insulin sensitivity. You improve that as you get some muscle. And the fact of the matter is, yes, okay, we know from professional athletes, there are very few Tom Bradys out there. Most athletes do their best in their 20s. You can even look, there are old charts on baseball averages across all baseball players. And the average, just starts to go down with each year. You don't have everything you did at 22 when you're 42. Okay.
Yep.
But the good news is we should all be able to get to 100 and stay sharp to 100. right now, as I mentioned, 15% of us are dying of Alzheimer's disease. That's a huge number.
It's crazy.
It
It's
is crazy, and it
Yeah.
should not be. And it's because we're not doing the very things that you're doing. So rather than saying it's a problem, you're not doing, the whatever the severity, these huge things that you were doing as a competitive athlete. And were you a sprinter? Were you a swimmer? What were you?
I was a tennis player. I played
okay.
on a tennis scholarship in college. So a lot of, that's a lot of, it's a
Huge
sprint
running.
type
Oh,
activity.
Yeah. And plus you're planting and changing really quickly. And it's coordination. By the way, it's one of the things that's best for your brain because
I've heard
it's
that.
muscles, it's oxygenation, and it's strategy. This idea of your thinking, and I was just at a wonderful exercise facility run by Ryan Glatt down in Southern California last week. And as Ryan's pointed out, it's this you're exercising and you're doing cerebral things that's actually really good for you. Why we love things like ping pong and why we love things like tennis and ballroom dancing. That's the thing to me, as I'm now an old guy. Okay, it's fun to do. Get out and play some pickleball, get out and play some tennis or golf, whatever. Enjoy it. Okay, I'm not going to be the sprinter that I was, years and years ago. That's okay. If I can keep my cognition good until 100, I will have won. So that's great.
Agreed.
And yes,
Agreed.
EWAT. And then the second thing is, have you ever used Katsu bands? So these were used by some of the Olympic athletes. But what these are restriction bands.
Yes,
you
I
use
have.
proximally arms and legs. Don't make it so tight that you have no blood flow, but you're restricting it a little. And what happens is, and by the way, very good for people who are elderly, my age and older, where you are getting more bang for your buck. You don't have to do as much as you did before, and you actually get more bang for your buck. So that's another great way to go.
Yeah, we do that. And I have a membership group of a bunch of menopausal women, and we work out together on Saturdays. And I started using those bands, and they're really interesting. And what I had heard is actually the metabolite that gets made from breaking down the muscle actually goes up into the brain and supports BDNF production.
Absolutely.
Have you heard that?
Absolutely. And also, you are making more ketones when you do that. And so it's very interesting. The ketones actually interact with histones and remove the inhibition of production of BDNF. And this was published out of Cornell several years ago. Very nice study. And they're showing that this effect of ketones to increase BDNF. Very interesting.
Amazing.
So yes, again, there are so many mechanisms that all feed into optimization. We all know it kind of intuitively when we're out exercising, when we're getting good sleep. All of these things are helpful. I think it's been unfortunate that so many of us as researchers have said, but we just want that silver bullet. We just want that pill to give to you. It's going to clear out your amyloid. Well, clearing out amyloid turns out not to be very helpful to people, as we've found from the amyloid clearing drugs. They don't make people better. They don't even keep you where you are. At the best, they slow the decline in people with Alzheimer's a little bit. The best yet is they slowed it by about 1/3. So that is not what we're looking for. We're looking for people to actually get better and, most importantly, stay better. That's the key.
Yeah. This is becoming quite trendy for all kinds of brain health and mood disorders, and a lot of attention and research is being brought to psychedelics, specifically psilocybin, MDMA. I know that our government here in America said it will be decriminalized and legalized for therapy type setting. Where does that fit in as a potential improvement for something like Alzheimer's? Because it does create neurogenesis.
Yeah.
Okay, you know how when you're trying to get in and out of fat burner, sugar burner, and sometimes you struggle? It might be that you have a metabolic blocker that's at play here. Want to know what those blockers are? Click on the link below and I'll take you straight to a giveaway, and you can have my list of metabolic blockers.
So this is a great point. So many of these things, it's knowing when to use it and how to use it. And so for some people, that's going to be a wonderful experience. And yes, the idea, as you said, neurogenesis. And the other thing is neuroplasticity. So creating the ability for new experiences and basically new synapses. So I am intrigued to see over the next few years, as the research comes out, Because now, as you said, it's trendy, but there's
Yeah.
not a lot of research.
Yeah.
And so I do worry, some people don't do so well on these things. And what about people who are frail, who are older? So you have to be careful. But
Yeah.
where I'm hoping that it's going to prove to be very effective is once we get rid of all the things that are actually driving the decline, we find out what infections you have, what is your hormonal status, what is your gut status. Let's fix all those things. And now we've gotten rid of what's driving the decline. Now we want to improve the synapses that are left. You've lost some synapses, okay, with all these drivers. How do we get those back? And it's going to be stem cells, and it's going to be intranasal trophic factors, and it's going to be BHRT and things like this that help you to reestablish those synapses. My hope is that some of these psychedelics are going to be helpful. Things like, is it going to be a ketamine experience? Is it going to be low dose psilocybin? We'll see, but I'm intrigued by this because they may, in fact, help you to bring back some of those synapses. So again, you've got to observe, and you've got to be adhering to the biochemistry. This is not magic. This is synaptic biochemistry. And there are things that can be harmful. Too much exercise, too much stress. These can be harmful. One of the common things we have is people have just been under massive stress and they think they're doing it for all the right reasons. They're winning a court case, whatever, but they are damaging their brains over this time. So as you said, it's this mismatch. It's an evolutionary mismatch. You're missing this. You should be living in a way that we were evolutionarily designed to live, not in something where you're going outside that, because that's breaking things down. So again, using them in the right ways could be very exciting.
I think what I really want to highlight, and I so 1,000% agree with you on this, is that we are always looking for the magic pill. And when it comes, from what I understand from dementia and Alzheimer, there's the magic pill doesn't even exist. So you're only left with lifestyle as your opportunity to start to change things. Is that what I hear you say? Because I don't want people to lose sight of how it's going to take work if you want your brain to continue to work for you.
And to be fair, this goes far beyond lifestyle. But you're right, it starts with lifestyle. So those 7 things I mentioned. But then you want to find out, okay, if I've got an ongoing infection with Bartonella, that's a common one, or Babesia. And again, here's another example. A woman who was ApoE44 had done great. She went from 35th percentile to the 98th percentile. Actually, she was one of the co-authors on my second book. She'd done a great job. She then started having some backsliding. And it was like, well, wait a minute, what's going on here? And she ended up having Babesia. And these chronic infections, you have to look carefully for them. And unfortunately, doctors aren't doing that. So it starts with lifestyle and diet, exercise, sleep, stress, those sorts of things. But then it looks at specifics for what's actually driving the problem. And again, we talked earlier about sleep apnea. That's another common one that's picked up. And another common one is just massive stress. As long as your amygdala is sitting there saying, I'm under stress, I'm under threat, it is not going to go back to that open. You literally have 2 modes where your neuroplastic part of your brain functions. One is the mode of things are good. There's not too much inflammation. I've got enough hormones. I got enough nutrients. I'm not under stress. I'm going to build and maintain. I'm going to get new memories. I'm going to do all that. The other mode you switch into is I am under assault. I got to pull back. I'm going to start making things smaller. I'm going to live in a smaller brain so that I can put my resources into fighting the insults. As long as you're stuck on that side, you're not going to be improving.
Yeah. And in that vein, one thing that I don't feel like is being highlighted enough as an important physical and mental health tool is human connection and the power of people coming together in community. Can you talk a little bit about that? Because if we look at the longest study ever done on happiness, it shows that when you've had good, positive relationships over a long period of time, that is one of the greatest tools you can use for your overall happiness. Do we have the same thing with Alzheimer's and dementia? Does it matter how we connect with others?
So again, it's not just my opinion. It's been published by excellent epidemiologists. people who had social networks, people who are interacting, these people did better. They were at lower risk. Now, again, it's not a cure by itself, but it definitely helps. And of course, you are stimulating new connections. You have to remember, go back to, this is a network insufficiency. You've got this amazing network within your brain that is able to take experiences and build and maintain new interactions, new synapses, new connections, or activate ones that are there. So when you are not feeding that, when you're demanding too much, too many insults, or when you are simply in a sedentary lifestyle. And by the way, depression is another part of this. This is something that, of course, increased with COVID-19, another unfortunate consequence of COVID-19. This is, pulling you back. This is associated with more inflammation, with more cognitive problems. And I would add another thing, because this has come up recently with some of the patients. It was noted that a lot of these people will note that they have something that's very much like adult ADD. They just don't attend to things. They don't focus the way they did before. And therefore, they're not setting up memory storage the way it should be set up. So it's important when someone's having memory issues to determine, is this more about the maintenance of the memory? Is this more about the consolidation after they've learned something to remembering it the next day? Or is this more like ADD? They're just all over here, and they do this for 1 minute and that for one, and they can't really attend to anything, because there are different ways to approach each of these.
How much does this play a part, the phone and social media? I mean, I can tell you, I will not touch TikTok, because my brain gets so like it can't come back from TikTok. So I have to be careful how much I allow those short bursts of information coming into my brain. They will rewire it in the wrong ways. So do we need to be aware of things that can damage our brain on our phone?
Yeah, I mean, there's no question. I mean, you probably saw just last week, a report came out saying, social media can be a problem. So there are lots of positives about social media, but there are also some negatives. So you have to be careful. And yes, things that are flipping you here, then there, then there. It's, it gets harder and harder for people to read a book, for example. Take some time, focus on things. You don't have to do it all day. Take some time. So again, there are positives and negatives, and you want to be able to use these in the right way at the right time. Find something that you love and focus on that, whatever that happens to be. And that's another thing that we find with the patients. Unearthing what it is. That, one of the most common thing I hear as they start to get better is that the spouse will say, they're so much more engaged. They were kind of not part of the conversation, or like looking to him or her for answers. And now they're back. They're engaged again. And that's so important. So get engaged, get involved, and get that point where you can now be part of what's going on.
Yeah. Oh, I love that. Well, let me finish up on this. So we ask every season, I have a different theme, and this year or this season was self-love. And in that, I have asked all my guests, do you have a self-love practice that you do every day? And what do you think your superpower is that you bring to the world? Because part of self-love for me is owning what you're really good at. So what do you think your superpower is, and do you have a self-love practice?
It's a great point. I don't have I don't have a self-love practice. And I think it's great that you mentioned that. I think it's a good thing. It's something that I need to learn. It's a great point. To me, my superpower is, and they used to make fun of me in college for this, is seeing things that other people don't see as similar, seeing them as being similar. And that's how we we originally saw, and my laboratory colleagues and I originally saw, that Alzheimer's disease is fundamentally a network insufficiency driven by those two things. It's how we developed the first protocol that actually reversed cognitive decline. And so, my goal is, and actually I was just down in Southern California last week, I'm working with Dr. David Merrill. We are hoping to set up the first program in the world that will allow people to have hope with all sorts of neurodegenerative illnesses. As you know, if you have it today, there's nothing you can do. ALS, frontotemporal dementia, there's no hope. These are all terminal illnesses. So taking precision medicine protocols, looking at all the things that are driving this. So my superpower is just that I'm interested in this stuff. I think about this all the time. It keeps me up at night, and it's so exciting to see people actually get better from what I was taught is a terminal illness, because the world is going to be better when we have less dementia in it.
Yeah. Well, we're grateful for all your work and for writing books and sharing it with the world. Talk about where people can find you, and specifically what did you call it? A cognoscopy?
Cognoscopy. So I'm just saying, we all know that we get a colonoscopy when we turn 50.
Yeah.
If you're 40 or over, please get a cognoscopy, because understanding where you stand is so helpful. It's relatively easy to do. Get some blood tests that unfortunately most of your doctors are not doing. You get some simple online cognitive screening. And then if you're already having symptoms, you want to include an MRI with volumetrics. But it's easy to do. Go to mycognoscopy.com. You can also, you can see me on Facebook, Dr. Dale Bredesen, on Twitter, on Instagram, all the usual sites.
Yeah.
And so that's probably the easiest way. And as you mentioned, a couple of books out, The End of Alzheimer's, for example, and it's available in 33 languages. So whatever you like, you can get it.
Yeah. So grateful for you. Thank you. And we will send everybody your way. So we're super thankful for all the work you're doing in the world. We really need more voices like yours. So thank you.
Thank you so much for the work you're doing. It's fantastic. Thanks for helping so many people.
Oh, my pleasure.
All right. Take care.
Okay, where are my gals that are struggling with hormonal imbalance? Bloated, feeling like you're not making progress with weight loss? You need to add these foods in so that you can support better hormonal health. There is a lifestyle that estrogen wants you to live, and there's a lifestyle that progesterone wants you to live.